Okay, what we're going to do today is look at the proper aseptic technique for compounding a kit in nuclear medicine technology, and we're going to look at the techniques for making it a sterile solution and for drawing and injecting into a vial. First of all, what we have here, we're pretending today, under normal circumstances, a vial of normal saline like this that has bulk technetium dose in it would be radioactive, and it would reside in a lead-shielded vial container like this. But for the purposes of your ability to see what's going on, we're going to do this unshielded. So what we have is bulk technetium, and this could be anywhere from maybe 50 to 100 millicuries, as it would have come from the central pharmacy, Radiopharmacy. And then we have a kit reaction vial. This particular one is for DMSA, which would be a renal imaging drug, and we're going to pretend that we're going to reconstitute, add the radioactive portion to the non-radioactive pharmaceutical. So in order to do this, first of all, we're going to make sure that each of these vials are treated aseptically. We're going to clean them, the tops of the vials, with an alcohol wipe, because that's where we're going to be introducing the needle, and of course we have gloves on to do this. We're going to do this for the DMSA vial. It's a little more complicated. There's a little circular port cover in the middle. Again, we're going to wipe that off with the alcohol wipe. And what we've done then is we would have assayed this. We would know how much radioactivity and what the volume is. This in particular, I believe, is a 10 cc volume of normal saline, and we would know that we say have 50 millicuries of technetium in here, and that would mean that we would have 5 millicuries per 1 ml of saline. So anyway, draw that out, and we're going to open our syringe. Let's see here, it should be opening at the top, but I'm not seeing it do that, so we're going to pop it this way and open it. We're going to take the cover of the syringe off. We're going to break the seal. This is a 3 cc syringe we have. Then we're going to place our needle on the top of the syringe. Again, I don't know why that's not opening as it should. Here it is. That's what I'm looking for. We peel it open. We do not touch the needle at the moment. And we put that on like that. Okay, and so remember, if we were actually doing this, both of these would actually be shielded. We would put the kit into another vial container, because when we add radioactivity to it, it will then be radioactive. So then what we're going to do is to plunge the needle into the center of the rubber stopper, and we're going to, with our thumb and index finger, we're going to make sure the bevel is fully immersed in the fluid, and we're going to just draw out 2 cc's. I can see that I have 2 cc's right there. 2 cc's of bulk technetium, or there we go. And so what I know is that I now have I have 10 millicuries at 5 millicuries each in this syringe. And then we're going to, I'll go ahead and just do it here. put this vial in here like this. I would not be holding this dose like this, and it actually would be in a syringe shield. The syringe would be. But I can then very carefully add the 2 cc's of saline into the reaction vial like that. Now, one thing I want to do, because it's a negative pressure vial, and when I get ready to withdraw my radioactive dose from the vial, and I don't want to make sure that no air has been introduced to it, I'm going to, I injected 2 mLs in volume, so what I'm going to do is draw back 2 mLs in air to make sure that we have the vial is pressurized in the way it should be. There we go. And then I'm going to, in this particular case, I'm going to do a one-handed recap of the syringe like this. I'm just sort of going to chase it like that, turn it up, and push it down. Never will I recap like that. Okay. Now, let's see, there's some things that are required, like you have to have the vial sit for a while, or it may be cooled down. But in any case, what I'm going to do now, not into the same bulk syringe that I reconstituted that in, but I'm actually going to then draw my dose up. Remember, I injected 10 millicuries into the vial, but I only need 5 millicuries for my dose. So I'm just going to withdraw 1 ml of my dose, and that'll give me 5 millicuries. Okay, again, I'm going to break the seal. I'm going to, it's difficult to see inside this vial, but I can actually see to draw it up, and I am drawing, and I am not fully, and I'm going to let it go back in a little bit, and I will draw some more. Let it cue up to make sure the bubble's gone. Pull out a little further. Remember, if you're not fully submerged in the fluid, you're not going to get a dose. Okay, and that's it. And I have my 1 cc dose there that's ready to be injected in the patient. I would then actually take this to the dose calibrator to measure the exact amount of the dose, which we hope is would be 5 millicuries, based on my calculation of activity and volume. And that would be it. Thank you very much.